Time now to spend a few minutes with our friend Dr. Marc Cromie from the Chattanooga Allergy Clinic. And Dr. Cromie, good to see you.
My man, welcome home,
Friend.
welcome home.
So glad to be here.
Baby. So glad.
All right, we're going to get into a brand new year with some health tips from you, the pro. And of course, we've been talking this morning about a lot of folks are seeing the flu. Hospitals are getting overrun with this. How do we know if it's the flu or seasonal allergies?
Well, here's the big difference, Chip. Seasonal allergies will cause runny nose, sneezing, cough, congestion. You may feel miserable, but the flu will cause a fever. That's the big difference. Allergies do not cause a rise in temperature above 100.5. So flu will cause aches, fatigue. Also, you can have congestion. You can have symptoms that look like allergies, but if there's a fever involved, if there's body aches, headaches, and if you feel like a truck hit you, you probably have influenza A or B and not allergies.
And make sure and get that treated as soon as you possibly
Yes.
can. All right, now you were talking about something just before we came on the air, a new shot, a new injection that's available for
so
allergies.
Chip, we're all familiar with our favorite allergy shots that we talk about that are disease modifying, that specifically change your immune system's overreactivity to pollens or your pets or the dust mites you live with. But now we're talking about biologic therapy, and these are therapies for severe persistent asthma. So by definition, if you have severe asthma, you have 2 exacerbations a year that require a round of prednisone or oral steroids or either an ER visit or a walk-in clinic visit. And a lot of patients have this, okay? And so what we have for them is new injections that are available. One's called Xolair, one's called Fasenra. Dupixent has been around for multiple disease states, including eczema, and as well as hives and other things that are allergic driven. And also there is one called Tezspire. Now what these drugs do is they're game changers. They block the allergic triggers that are specific for asthma, these inflammatory mediators that are out there, and they will prevent exacerbations. They will improve quality of life. There's even studies that show it could put asthma in remission, which we've never talked about before. 5,000 people a year die of asthma. This is a game changer, and we can do these at the Chattanooga Allergy Clinic.
5,000 people a year die of asthma?
Die. Preventable deaths from asthma.
Wow.
And a third of these patients have mild asthma. They don't even feel like their asthma is out of whack, but all of a sudden they have an asthma attack, and the mucus that's in their lungs causes a plug, and they die of asphyxiation.
As a medical pro, what was it like when you heard that, wow, we might be able to put asthma in remission?
Well, honestly, I didn't believe it. We've talked about years as a child growing up with asthma. We never believed that asthma went away. We thought you wouldn't grow out of it, but there'd be periods of time where your asthma would be fully under control, and then something would happen. And we've seen it with COVID. Patients that have asthma as childhood that have just had allergies doing well, as adults get COVID and their asthma comes back. So something sets that inflammatory pathway back into the airways and causes asthma and inflammation. But this can change it, and it can put you out of its misery. So we're happy about that.
I know it's kind of hard for you to say, but let's say you had a proverbial crystal ball. Where do you think that particular part of asthma treatment is going to be 2 years from now?
I think it's going to be much more prevalent than it is now. The studies show that only 20% of asthmatics that have severe asthma are on these biologic therapies. A lot of times it's because they're new, they may be expensive. We have a whole department of people that just are responsible for buy and bill these biologics. So we have to go to the insurance companies, we have to show them the records, we have to prove that they've had exacerbations, prove they've already been on asthma medicines. And so the insurance companies do cover them, and we make it affordable for our patients, but it's a lot of work. So doctors that aren't specialists with asthma, they're not going to deal with this because it's a lot of work. But that's why they can refer them to the Chattanooga Allergy Clinic. Anybody with asthma needs to be allergy tested because allergies are the main trigger for asthma, and we are the specialists.
And Chattanooga Allergy Clinic over the years has been a pioneer in these newer treatments, and
50 years,
quite
50
frankly,
years, baby.
Ramroding the insurance companies to play ball, because a lot of times it's a shame, but you know as well as I do, a lot of insurance companies have got somebody looking at a chart going, no, sorry, patient, can't have it.
It's amazing. We have to do what we call peer-to-peers, where we're trying to get a drug prior approved. And so I'm talking to somebody on the phone about a disease state, and I can tell that they have no idea what's going on. They're just going down a checklist, like you said. And typically they're very friendly. Once I show them or talk to them about this is what they needed, they're like, okay, it's approved. But it's a lot of work. A lot of people don't have the time or the money to go through it or the resources. So luckily at the Chattanooga Allergy Clinic, we have the employees, we have the power to do it, and we can make life better to live. We can help you live life to the fullest.
A lot of us patients don't have the patience to deal with
That's patience of the patients.
Like hey, you're the man, Dr. Marc Cromie, Chattanooga Allergy Clinic. They're up to what, 9, 10 different locations?
We're just going to settle for 8 now, Chip.
8? All right, 8 locations around the area. They're easy to find. Check them out. Dr. Cromie, the website is
ChattanoogaAllergyClinic.com.
We're back after this.